So as promised, I'm going to be posting at least twice a week some techniques with NCLEX style questions. I would say that a lot of the requests that I get as far as tutoring, so virtual and live tutoring, is just to work through questions. And trust me, I know how confusing and how difficult the NCLEX style questions can be because one, I was a nursing student before, and two, I taught for a long time. So this is going to be kind of like a helpful tutorial that I'll do, again, twice a week. So if you're really struggling with questions, just taking tests in class, or you're going to be testing for your NCLEX soon, and maybe you're just looking for some tips and some tricks to answer the questions and to really figure out what it's asking you, then these videos are going to be helpful for you. So what I did is I picked out 3 questions that came up a lot this week during some of my tutoring sessions. And each of these questions is a different example of a certain technique that you can actually use and that you should use to answer NCLEX style questions. So if we look at the first one, so we're looking at this one right here. The question reads, and I actually posted this on Instagram. So the question reads, after magnetic resonance imaging, or MRI, to rule out an expanding brain lesion, the nurse prepares the client for a lumbar puncture, or LP, with oil-based contrast. What information would the nurse include when teaching the client about the LP? Now, what I always suggest is when you're reading NCLEX style questions, read it twice. So read it the first time, just as a whole, and then that second time, go back and figure out, what is this question asking me? So essentially, we're looking for teaching, right, about the LP. The client is having a lumbar puncture, so what's the teaching we're going to do for the LP? So we have paralysis is a risk secondary to needle insertion through the spinal cord. Maintain a full bladder for better visualization. Keep the head flat to avoid headache. Straighten the legs slowly during the procedure. Now, the first thing we can think with this question, and we can do it with all NCLEX style questions, is expected outcome. I want you to always think about expected outcome. Based off of the scenario, what do you expect from this scenario? What's the expected outcome? Now, if we're looking at A, paralysis is a risk secondary to needle insertion through the spinal cord. A lot of people picked A for this question when I posted on Instagram. But there's a problem with this. I know you're thinking, well, a lumbar puncture, it goes through the spine, they can be paralyzed, it's a risk. Well, that's not necessarily true. And what's not true about this? It says secondary to needle insertion through the spinal cord. That's a key word. So this right here is our keyword example. Don't miss out on those. A lumbar puncture does not go through the spinal cord. It's actually just going to be in the space surrounding the spinal cord. So going through the spinal cord, that's not true. Expected outcomes, right? Maintain a full bladder for better visualization. What does a full bladder have to do with the lumbar puncture? Nothing, right? Those things are not related. Keep the head flat to avoid headache. Well, that's true, right? We know this is a true statement that we want to keep that head flat so that there's not a huge, difference in the fluid. And D, straighten the legs slowly during the procedure. Well, expected outcome, we know during a lumbar puncture that they're kind of going to be in this fetal position, so knees to chest. We don't want them to have their legs straightened because it makes it more difficult to get access to that space. So this can't be right. So that leaves us with C, keeping the head flat to avoid headache. And that's an expected outcome after a lumbar puncture procedure. Now, again, keyword. This is our prime keyword example. You should have been stuck with A and C if you were just looking at this question right off the bat. And by really reading it carefully, you'd have seen that was wrong just based off of that through. Now, if we go to this second question here. While planning post-operative care for an obese client prior to surgery, the nurse would develop which nursing diagnosis specific to the effect obesity has on post-surgical recovery. So that's my first time going through the question, right? So the second time, I'm going to look for just what is the question asking me, right? So I'm looking for nursing diagnosis specific to the effect obesity has on post-surgical recovery. That's what I'm looking for. So I have risk for ineffective tissue perfusion, cardiopulmonary. I have excess fluid volume, risk for impaired skin integrity, pressure ulcers. And D, ineffective thermoregulation. So first thing, what can we get rid of? Always try to get rid of the things first that you don't need. So excess fluid volume, I'm looking at this and I think this has really nothing to do with anything, right? I'm talking about an obese client. There's no indication that there's too much fluid. There's no indication there's complications of fluid. This has to go because we're not talking about fluid at all. And ineffective thermoregulation, I can get rid of that. My obese client does not have ineffective thermoregulation. That's not an expected outcome. So I would be left with two things here. Now this question is going to be an example of our priority. Make sure I spell that right. Priority. Now, I'm left with risk for ineffective tissue perfusion. I know this can be an expected outcome secondary to an obese client who's recovering. And risk for skin integrity. I'm thinking an obese client laying in bed, recovering, they may be at risk for developing some decubitus ulcers, right? Now, if we're thinking about priority, what is more important than the other? You might be thinking about ABCs, right? Airway, breathing, circulation. And that would bring you to A, cardiopulmonary. So ineffective tissue perfusion is more important, takes higher priority than risk for impaired skin integrity. Also, these pressure ulcers, if you're thinking about, again, expected outcomes and nursing interventions, we should be moving our patients, or repositioning our patients, I should say, every 2 hours at least. And for this patient that we know is obese and is recovering from post-surgical, procedure, whatever they had done, we need to be doing interventions to prevent pressure ulcers. And so that's another reason why we can get rid of that one. And their last one that's come up a couple times is this here. A 40-year-old athletic male client has been diagnosed with osteoarthritis of the knee. To which client factor will the nurse most likely attribute the etiology of the disease? So what's my key points in here? What is this question really asking me? I'm talking about a 40-year-old male athletic client, right? They have osteoarthritis. Now I want to know what factor attributed to this disease. Now this is all the information I have. Now think about expected outcomes, expected findings of osteoarthritis. Age. Is the fact that he's 40 an attribute to osteoarthritis? No, he's not in an age that he's at risk for developing osteoarthritis. Gender. He's a male. Are males more prone to osteoarthritis? No, I know that's not the expected outcome. Previous trauma. Well, I'm thinking he's a 40-year-old athletic male, right? So expected outcome, he definitely has some wear and tear on his bones and his joints. So I'm going to leave that alone. And current weight. Well, I know that weight is a factor in osteoarthritis. For instance, if there's an obese patient, they would be at greater risk, of developing osteoarthritis than someone that's at a normal weight. But there's no information in here that says what his weight is, and it's telling me he's athletic. So an expected outcome is that he's not going to be an overweight patient, right? So I can get rid of that. And that leaves me with C, previous trauma. Previous trauma secondary to the fact that he's an athletic male, you're thinking about wear and tear, okay? So this example here is a great example of outcomes. So we're talking about expected outcomes. And this is something that you can apply to really every single NCLEX question. And the keys to all of these, always use a process of elimination. Always get rid of the things that you know absolutely are not right. Think about priority. Always think about expected outcomes. And really make sure that you're focusing yourself on finding out what the question is asking you. A lot of questions are going to be filled with just, words and distractors and information you don't need, but it's going to be your job to really sift through all of that and figure out what is the question asking you. And if you get into the habit of applying that to all of your testing scenarios, all of your practice scenarios, you're going to get super, super good at answering these questions, and it's going to become a lot easier. Now, these are just three of the big examples that came up this week, some tricky questions for some of my students. So I want to share this with you. But definitely stay tuned because I'm going to be posting questions more and more often. and working through them so you can see just how I rationalize and how you can rationalize too to help to, be successful and do your very best on these questions and these tests that you get. So I hope you found this helpful.